Hi, I'm Justin. I've been talking about doing a vlog for a while, and I kind of had an idea of what I wanted it to be, but didn't really have it put together very well. So, this is going to be my first attempt at this blog. Excuse me. I'm going to try to be covering, I have some notes here that I didn't get to write down very well, but I'm going to try to cover um, things like it's always going to be regarding mental health and how it associates with whatever the subject is, particularly really serious mental health issues, which all are pretty serious, can be pretty serious, especially if they're untreated or undiagnosed or misdiagnosed, mistreated, or many other ways. So I'm also going to talk about addiction a lot. I'm going to talk about my own experiences with addiction. I am a recovering heroin addict. I've been off of heroin since January of 2019, so I've got over a year clean. And there are different ways people can get clean, and I'll also talk about that. I'm also going to talk about communication. Communication is really very important. And if you have any mental health issues, there could be problems with communication. I'm going to go over that. Also with addiction and communication, relationships. I'm going to be talking about relationships, mental health and relationships, addiction, communication, relationships, self-respect. I'm going to talk about that, and I'm going to talk about mistakes we've made that we need to be honest with ourselves about, and be honest with the other people around us who matter, that you would like honesty from, at least. So I'm going to talk about how that's a give and take. But today, what I'm going to go over is, I'm just going to go over it. I'm going to discuss a lot of topics, but going for my notes now instead of just, freehand and free whatevering it. I'm going to discuss a lot of topics, but they'll always be about these things in general: addiction and recovery, and the times in between. Communication, in general terms, relationships. I don't necessarily mean, baby relationships, like you're my baby type of thing. Romantic relationships, I don't necessarily always mean that. I mean friendships, family relationships, anything that you value as a relationship. Communication, I think I said that. Self-respect, it is important. I'm probably also going to talk a lot about poverty and possibly, policies that are really important for poverty. I'm going to talk about reasons people are still poor and stigmatization about all of these. I'm also going to talk about all of these in general, how they all interact with each other, affect each other, and when you have one, you often have many others. I'm also going to talk about how mental health plays a seriously destructive and painful role, if you want to say that, in how it affects all of these subjects and other daily parts of life, even in every moment of life sometimes. It is inescapable. Mental health problems are like a trap, is very, it can feel very trapping, and you can often feel very misunderstood. Um, as far as mistakes go, we need to be able to learn from them. We need to be honest with ourselves and others about them. I went over that a little bit before, but if we keep making the same mistakes over and over again, we're not going to learn from them. We're not learning from them. And it's a shame to have to go through the same mistakes more than once. It drives you crazy. Now, if you're trying to do something about them and there's still problems, we can go over that later. Sometimes it feels like you're just being hit with wrecking ball after wrecking ball, and I do know how that feels. lot of times people are like, well, they're probably using again. No way they can possibly not have a dollar. Some people just cannot fathom a person not having $1. You know, but break it to you now. I hate to, but there's people who have negative money. If you can freaking conceive that, they're worth negative anyway, and that's how they feel. Because a lot of how you feel is based on how people treat you, and it just is. If you're told every day for a year, multiple times a day, for however long, that you're a stupid fucking piece of shit, you're gonna, without even wanting to, without realizing it, you're going to start feeling devalued. You're going to start feeling much like a stupid fucking piece of shit. And that was something that was told to me by someone I cared about multiple times a day for over a year, and at least once every day or two for, probably the previous year to year and a half. Nonetheless, it was a lot. I could be incorrect about the exact amount, but it definitely was a lot. Anyway, I don't want to get into too much of that because that's a little bit more personal for not just me. I guess the first thing I can talk about is, well, I talked about mistakes a little bit. I'm not going to get too much into that. Mental health, it's very important that you accept the following about mental health and addiction. Accepting that you may or do have a mental illness. If you've been diagnosed, you need to accept that you may. A lot of people with addiction issues suffer from something that's internal. They may not realize it, but there's a reason they're covering up the way they feel, especially if it's something like meth or heroin, something so strong that's so destructive. Personally, my drug was heroin, and it's just so destructive. It takes over who you are. Meth can do the same thing. It takes over who you are, and you will do anything to get those drugs. And I'll go over that a little bit more in a moment, too. You also, with mental health and addiction, have to accept that you are in active addiction. If you are if you are an addict, which, only if you are, but you can't lie to yourself. Don't tell yourself you can quit at any time. Just go ahead and quit. We'll see if you're an addict. And I don't mean that in a shitty way. I mean that as, if you're an addict, you need to recognize it. Recognize that you're an addict. Recognize that you need help. Whether the people around you are right or wrong, and that'll piss you off if they were turned out to be right. It doesn't matter. You need to do this for yourself. It's for you. Forget how it affects other people. Other people are not going to be there for you as much as you will always be there for yourself. You are the one who will always look out for yourself. And if you're not doing it, or you're not in the condition to do it, my God, go to the hospital. Someone needs to be there to back you up. Get a social worker. Talk to people. Talk to one-on-one if you can't do it in a group. But address your problems. Understand your problems. Help someone. Help find and dig and figure out where you are your problems are based, or where your hurt is based. If you have that, some people are addicts for possibly other reasons, but most of the time with mental health and addiction, there's something that maybe it's not one thing, maybe it's just a general thing. I grew up in a house that was loving. My parents are still married to this day. Didn't go without or anything like that at all. So, maybe other than I just wore hand-me-downs and stuff, but we were doing fine. Other kids called us rich, but we're not rich. We were not rich at all. But we had a house, and I guess I lived in the country, and a lot of people lived in trailer houses, and I wasn't familiar with too familiar with that kind of life at that age, and I was in grade school. So I was doing fine, and I'm not your typical broken home guy or addict. It can happen to the best of us. My parents did their very best to raise me. I guess like them, but they did their very best, and there's no doubt about that. They were not prepared, I guess, for the possibility that I could turn out very differently than the way that they might have hoped. Anyhow, it's nothing on them. So, accepting that you are in active addiction. It's a serious medical and psychiatric problem. Addiction, it is. It's treated like some stigma. Makes you are a drug addict. Oh, you're the bane of society. The war on drugs is called you responsible for everything that's wrong with society. The poor people, because of you. The reason people owe money to anything is because of you. Medical problems and hospitals being slow are because of people like you. Well, let me tell you something. That was not always how people viewed people who had problems with drug addiction. Not at all. Before the war on drugs, it was a medical issue, but it was no longer been really recognized by society as a medical issue, which it is. It is a disease. It is an actual medical problem, and it's also psychiatric, psychological, and it all needs to be addressed for best results. Be prepared for possible relationship issues, which may make you feel alone or abandoned. I'm sorry to inform you of this, but it is not going to be possible for most other people to understand what I call the drowning effect, nor how truly emergent your situation of addiction, active addiction, or in recovery. These can happen at any time. What I call the drowning effect, which I'll go into in just a moment. How urgent your situation was or is, and it seems to be more difficult to relate these personal crises that you're facing to people or others who may be unable to relate to such a struggle, or if their struggles are like first world problems and, God, what am I going to do? My car got scratched at the Whole Foods or something, problems that just come on, I'm tired of hearing about it. People have different ways of calling problems, but the drowning effect. Think of, let's just say you're in a pond or whatever, a lake or a swimming pool or whatever. Just say a swimming pool, because that's more likely where you'd want to swim. And you're going to say something about no one should go swimming in a pond. So let's call it a swimming pool. You're drowning. Aren't there lifeguards? Aren't there people around there who see you drowning? It's like they don't realize that you are drowning. But you sure do look ridiculous drowning. You look ridiculous. You yelling and screaming. Now you're cussing at the people who aren't trying to help you out. I got news for every goddamn person out there who has not felt like they are drowning. No one who is drowning gives a fuck what you think about how they look at that moment. They're drowning. This is not an exaggeration. This is a comparison to how it feels to be drowning and to have no help. And to be stigmatized for that. Maybe you offended some people when you were drowning and they didn't understand it. Now they take that, what you said, seriously because you said something. Well, a lot of people with mental illness will say things to get attention from someone because they need the attention, in my case, or in another case of someone who may be drowning. Say something to get the attention, to let them know how serious this is. You're not saying this for no reason. It's something it makes sense at the time. This person doesn't understand how serious this situation is in your life. They're not taking you seriously. You're tired of people assuming that you're just faking something. You feel like you're not being taken seriously, and that if only someone knew how serious it was, that you'd probably be helped. Maybe you were given the impression during active addiction that all you had to do is quit. It'd be so easy, and no one's going to help you while you're in addiction. No one's going to. Why would someone help you? After a while anyway, pay bills and stuff like that. Well, if you get clean, you probably won't have these problems and stuff like that. Or maybe even there was a direct statement of something to the effect of, I would help someone who's wanting to help themselves or something like that. And, again, saying those kind of things to people, great. Follow through if you say it. Communication. That's part of communication. It's also part of mistakes. Being honest with yourself and others about them. If you have a family member or you yourself have mental health issues. I personally have borderline personality and severe anxiety issues, insomnia, depression. I'll stop there. That's what I can think of off the top of my head in that amount of time. So, a lot of other people have different types of mental health issues, such as bipolar disorder, used to be called manic depressive, but there's bipolar, which are ups and downs. Now, borderline, it's so hard to explain. It's best to look it up on YouTube. There's some videos about it, but I've posted some videos about it on my personal Facebook page, which if I can find, I'll try to attach to this, or I'll find some other videos to attach about borderline personality disorder and about bipolar 2 and any other disorders, mental health issues that you have information about and you think's great. Show it to me. Let me see what it is, and I will share it. Or if you have any questions about wanting to find out more information about certain types of behaviors, what it could be. I am not a clinician. I am a recovering heroin addict. I am a smart person. Didn't graduate from college, but I did well in college and stuff like that. But I want to help anyone with any information that they're seeking. So if there's any information that you're seeking, if you want to ask me a direct question, as frank as you want, I'll answer it. I can answer it on video, or I can answer it in person, depending on how much impact I guess it might have on helping other people, or if you just want it that way, maybe I can do that. This is, again, my first video um, where we're talking about addiction, mental health, all kinds of mental health disorders, um, communication, relationships, self respect, mistakes, and how they all can interact with each other. Poverty as well. I almost forgot that one. We're also going to talk about poverty. We didn't talk about it much today, but let me see if I can touch a few more topics that we're going to be explain a few more topics. I'm sorry, that we're going to be touching on in the future, hopefully. Communication, mistakes, honesty. Be honest with yourself and honest with those who matter. And here is your homework. I want you to practice not lying about little things, about anything, big things, little things. No exaggerating. No bluster, no embellishments. No white lies, no any kind of etc. No bullshitters, no bullshitting. No lies for any reason. Practice this for real life. Practice saying no, telling no lies, and seeing how often do you exaggerate. How often do you tell a lie that just that didn't need to be told. There was no reason to tell that lie, was there? Does the person you're telling these lies to really, are they really going to care that you said A versus B? I personally would rather hear the truth. I don't care what it is. If I find out that there's a lie, it really upsets me. A lot of people with mental health disorders, which I guess I'm trying to deal with mine, but I've always had very, very serious problems with lies, especially little ones for some reason. Big ones, it's like I guess I can understand a big one, but they're still shitty. But I'd still rather know the truth, because a lie at all to me is like saying to me that you don't trust me with the information, or how I'm going to act with the information. Whenever I'm trying to address my mental health issues, and someone lies to me because I guess, I don't know why, maybe they don't want me to react about something. Well, I'd rather be given the respect of given the opportunity to be seen whether or not I react. I'm trying to work on myself. But I'm just asking. People do that in general for everyone else too. That's trying. But see how often you've been lying, and how often are you now believing your own lies? That is a real thing. No shit. I do actually have more to talk about. I'm going to talk about just a little thing on relationships. Relationships require communication, good communication. They require honesty. Communication also requires honesty, good communication. Mistakes, be honest about them. Be able to communicate about them in your relationships, and that require honest communication and truth. Be realistic, but always honest. If you're in a new relationship, or if you're in a relationship with someone who has a mental health issue, or if you both have mental health issues, or you've got any of the issues that I've brought up, it's okay to do counseling. Individual therapy is absolutely great. Couples counseling is great, even better when you both are like totally willing and totally into it. And be willing and into it, because there's nothing wrong with counseling or couples counseling. I think it shows that you're willing to try. Even if you're not having problems, go. It's not going to hurt nothing. Just go and see if you can please your partner. Maybe you can make them happy in a way you didn't know they that you could, and maybe they can do something for you that they didn't know they could. And individual therapy is also really great. I know therapists themselves go to therapists because they sit and listen to people's problems all day. But yeah, it's a good thing. See if your insurance covers you. It's great and also very common, couples counseling and individuals counseling, for people and for mental health patients. It's not stigmatized like it used to be. It's okay to go to therapy. No one's gonna. In fact, a lot of people will say, "Oh, well, my therapist said this." Well, I guess it's like all um, in to be in therapy to have problems. You got to be busy, busy, busy to have problems. Yeah. Anyway, a lot of people like to say that. Anyway, mental health and self-respect. It's easy and very common for mental health patients to, especially those who suffer from addiction and those who are in addiction and also suffer from mental health, if you want to say it that way, as both in regards to self-respect, mental health, and addiction, to have so little self-worth or little self-respect or sometimes even awareness that their self-worth or self-respect is as dead, basically gone as it is, because of possibly how it comes about, which is oftentimes over over time, like I mentioned, over time, people can, let's say a homeless person on the street, um, maybe they're ignored all dang day, and they feel like a second class citizen because people treat them like second class citizens. We've all done that. We've all done it. Um, some of us know better, some of us don't, and I will speak to a homeless person now. I know better than that. I don't give my money away because I am poverty stricken. Again, haven't gone over that much, but I'm not going to talk about my situation. I'm going to talk about it in general. Um, Again, so some people who, let's say on the street, have been so demoralized due to their, you know, being homeless or whatever, and not accepted by general society, maybe just other homeless people, which, that's good. They have some people to talk to, but they generally know their place. And people knowing their place is something that makes people uncomfortable when someone moves out of that place. And they don't even realize that they've been so used to someone being in that place that that person's movement out of that place is disruptive and often causes emotional confusion for some others. And it can be difficult when someone decides they want their self-respect back. And when you change your boundaries of what's okay, how it's okay to be treated, when you change your personal boundaries, when someone used to be able to say to you let's say they said, hey, you fucking drug addict. Okay, something like that. And you were just like, hey, what's up? Because you're a fucking drug addict. You knew it. And you're just like, whatever. They give you, maybe they are nice to you sometimes, but they call you a fucking drug addict. There are lines that we will let people cross when we have no self-respect or little self-respect or forget that we even have a sense of self. For the longest time, I didn't even know who I was myself. I did not have my own identity. Oftentimes that's called being, it's not always this, but it can be called being a codependent. But I didn't have my own identity. I didn't have my own purpose. I was okay with it, but I didn't know any better. And I highly recommend finding a purpose, something you enjoy in life, something that you want to do in life. This is my first step in doing what I want to do in life. I'd like to write a book, an autobiography, and I'd also like to develop a plan for mental health treatment that is an alternative to the so common theme of tough love, which does not work the way that it's whoever's implementing it would like it to work. It does not work in that way, especially for those with mental health disorders. I can't stress that enough. I can't stress that enough. If someone has mental health disorders, you may have to hold their hand. Sorry. That's a fact. You may have to. You may not like it. You may bitch about it. You may disagree with me. But some people need that. I know of people who are in the situation they are in, not because they don't want to be out, but because they know how alone they'd be on the other side of addiction. And they're not sure if they can do that on their own. They're not sure if they can get through the detox on their own. It's hard. It is physically and emotionally, however you want to describe it, physically, emotionally exhausting. You cannot compare anything like that to any other experience. Going through withdrawals and detoxing is, I'm going to argue that it's probably a worse experience than giving birth, because at least after you give birth, you got a baby to hold. What you got after detox is having to no longer cover up your problems or whatever problems there are facing you. Maybe there's grief you need to deal with and you don't think you can, don't know if you can deal with. You'll need help with that. That's a mental health issue. Even though it's just grief, maybe it's just situational for you, but you may have taken a path down the road of addiction after a traumatic event without intending to, certainly. No one intends to become an addict. No one wants to be an addict. No. No one wants to live like that, and if they say they do, they just don't understand it. They're being childish, and they should be slapped in the face. Not really, but someone needs to give them a wake-up call. All right. Okay, I'm going to go into my phone because I've got my last notes here, I believe. Yeah, I mentioned how over time, for different relative reasons, a person can be able to lose their self-respect to the point of where it is non-existent sense of self at all. It's all been lost. Your self-respect, your image of self is all gone. You don't have that anymore. And that's often due to stigmatization and the way that makes people view you. And I hate to put it on other people and not say it's because you need to fix yourself. You do. But you have to realize this. And the key is catching this early. Don't let yourself get addicted. Don't let yourself go down a road of years, please. It will change the dynamic of your entire life, and you'll never be able to get back all of what you lost if you go down that road, because there will be tensions between you, your child, your parents, your friends. You'll lose your friends, some of your friends, not to death or anything, but to misunderstandings, miscommunications, assumptions, and hurt. Miscommunications and misunderstandings are the number one cause of my tears. Assumptions about me, my intentions, misunderstandings about what I'm trying to do with my life, or about my general intentions, about my nature. I would call that more than a misunderstanding. When someone questions my very nature, it's very offensive. So, yeah, I would react strongly to that because I do have borderline personality disorder. And so, like I said, I am a mental health patient who is in recovery, and I have over a year clean. My actual date of last time I used heroin was the date I quit. I didn't relapse that time, but I had help, which I'll talk about it again in the future. But I don't know that I could have done it on my own. I was really bad. I realized that I didn't have a support system. I didn't have resources anymore, and I lost a lot, pretty much in a realization of one day. Anyway, so I'm going to read from my phone now, and forgive me for bouncing around on subjects. I kind of put this together quickly, and I'll let you in on a little secret at the end of this. And I'll probably forget, so I'll just do it now. My notes, I didn't have proper way to take notes, so I used thank the government. Anyway, I used a box because I didn't have any paper. Hell, it's coronavirus time. Shit. I'm not going out for paper. Okay. Learning from mistakes, never repeating them, being humble and open to being wrong. Because that's how we learn. That's how we learn. And being open to being wrong about anything. You could be wrong about something. But if you're sure about it, make sure one of you proves the other person right or wrong, and don't get offended about it. That's how we learn. Just because you're wrong doesn't mean that you're bad, but you're unintelligent or anything. The more open you are to being corrected, the more intelligence it shows. I'll talk a little bit about judginess. I've come to the terms on my own that no one can judge me, my life struggles, experiences, or mistakes, because if they haven't been through my life's struggles, experiences, or mistakes, they can't understand who I am fully. They can't, I mean, there's people don't just do random things. Even people with mental health disorders, unless when I say do random things, I mean like in general, the experiences and struggles of a person's life in all kinds of contexts shapes who they are. That's what I meant to. That's how I meant to phrase it. So I apologize. I've made mistakes. I do still undergo mental health treatment, and being honest with yourself and others that we talked about who matter, those who you want honesty from, and who expect honesty from you, I think are the ones who expect honesty from you are the ones who should give you honesty, and who should also respect how you feel about what you're going through, and not being a I don't know what to call it, a person who stigmatizes someone so much and attaches so much negativity to labels. We can peel labels off. They're not permanent. Not even permanent markers. Permanent. Come on now. Be honest with yourself and others about your mistakes. Be realistic about your expectations, and be realistic about your expectations of others. That's hard. Especially be realistic about your expectations of others who are in recovery. And if you're in recovery, be realistic about your expectations with others. I've said before, that certain people will not understand because they've not gone through it. Others will be open to hearing. That's great, but a lot of folks just can't grasp it. Just never happened in the first place. Just can't fathom it. Old-fashioned folks who had the luxury of, I don't know if it's a luxury or a disadvantage, but it's growing up ignorant to those types of experiences. When they say ignorance is bliss, that's what they mean. Not being exposed to certain elements of society, but certainly ignorance is not a good thing. It's a good thing when you're young, but it's great to be educated. I highly recommend it. But be realistic about your expectations of yourself and of others. If you're coming out of addiction, active addiction, if you're in recovery, be realistic about how your recovery is going to go. It's not going to be like Cinderella at the ball or something like that. And I don't know about the part where it's 12 and all that. It's not going to be a fun time. It's going to be hard. Yeah, you're in recovery. Yeah, you're not in active addiction. That's great. But it could be hard because maybe you lost your home while you were in active addiction. Maybe you lost your child. Maybe you lost custody of more than one child, or maybe you have lost more than that. It's okay to have a setback, though. Which goes in with expectations about ourselves and of others. This is my dog, Pharaoh. Hi, Pharaoh. Sorry, I had to say hi to him. And it's okay to have setbacks because we need to understand that we should learn from our experiences and from our mistakes. Both. You can have good experiences that you can learn from, too. I'm sure if you're anything like me, you're ready to quit having to learn through these hard lessons. And the last thing you need is more difficulty from others or tough love. Is often the last thing you need is tough love. And people who believe in tough love, well, I just want to tell them that those are two words that do not go together, much less would actually help someone who has a serious disease like addiction, which truly makes you do things you would never ordinarily do. Your life is tough enough without being ultimately sidelined by people you know you still care about. What can we do instead of tough love? Gee, I have no idea. As a family member or friend, you cannot give the addict money for drugs, directly money for drugs, or indirectly if you know it's for drugs, you can't give it to them. I don't see harm in occasionally helping an addict with an electric bill or giving them food or something because of the compulsion to use overtaking their better judgment. There is no, oh, I should save that for my electric bill when you're a drug addict. No. If you want your friend to eat, feed them. If you want them to have water, be great if they paid it themselves, but they may do that to themselves and you may not be able to help them for whatever reason. But I'm telling you, people will not get prescriptions that they need to live. They will not get food they need to live. They will consider their breakfast whether or not they had a smoke on that pipe or whether or not they had that injection. Because of the compulsion to use overtaking their much better judgment, as I previously mentioned. You can love the person who's still inside there, because they are still there, but they're fighting behind the disease of addiction. To be helped and taken seriously, but also feel they can't ask for help sometimes because, you know, folks tend to get mad at you if you don't succeed. Well, that's the last time I'm going to help them if they can't help themselves. That kind of attitude that you see on shows like Intervention. My God, that show gets on my nerves. A person needs to be taken seriously. A person who's not accepted their addiction, they might need an intervention. But that show casts a wide net. I hope you understand what I mean. That is not for every case at all. But people often feel that they can't ask for help because of how people might get mad if they have a relapse. And rather than treating the relapse like part of their recovery, which it is, almost nobody recovers without having relapsed. I tried to get clean many, many times before I actually did get clean. And I got clean using Suboxone. I do not currently take Suboxone, but I did take it for a few months. And I recommend just going directly off the heroin, but if you can't do it, I mean, there are those options out there like Suboxone and methadone. But it really takes a serious change in outlook on your life. You want to get off Suboxone. For me, it made me depressed as hell, all hell. It was horrible. Okay, so worrying about what people will think about your effort of recovery, whether they'll take you seriously if you relapse. I'm not giving, it's not a right to relapse, but it needs to be understood that if you do relapse, it is not the end of the world, but you've got to be serious about it. If you relapse, you're going to feel a tremendous amount of setback, a feeling of that, you know, God, I messed this up. Now what am I going to do? You're going to keep going because the fact that you feel that way means you're taking it seriously and you had a setback of a relapse while you're trying to recover. A lot of people have that and they feel like that's the end. They can't try anymore. No, that's a part of your recovery. It is. Okay. The person that you know is still inside of that addicted person with the disease of addiction. Even the person you know is still in there. So what we got to say to a person who's relapsed, by the way, is, okay, we can get past that. It is common. Don't explode about that person. They may expect you to. Don't surprise them. Be supportive. That will be the surprise that may get them through, especially if they're expecting a bunch of shit from you. Just change your tactic. If you really want to help this person, you got to try a different approach because what you're trying isn't working either. What they're trying isn't working like you've been saying, and what you're trying isn't working either. I understand it's not your responsibility to help someone in addiction, but if you understood it, you would understand that people do need help, and it's very important to know how to give that help if you're going to try. The person you know is still in there even after recovery. They may seem to act different, but they're possibly very guarded. They could be very hurt. Even after recovery. And oftentimes they may claim to have a different outlook on life, or, you know, view things differently and more down to earth. It's generally a good thing. It really is. Let them accept them and their new outlook on life. It's generally going to be a healthy outlook on life. Maybe they'll turn into like someone who, like myself, just takes natural things that help with pain, as opposed to opiates or anything like that. Which for my chronic pain, I don't take any prescription opiate pain medication at all. So people who may say that they view the world differently may also be like told that, okay, these person's done fried their brain. They think they know everything now. And, well, they don't, but they have an experience which they can certainly help people with. And that is the type of insight that they've gained. And I personally feel a responsibility to use it to help people. Okay. Who are in my position, and other people who are in the position to help people in positions of those to help whoever wants to help those that are addicts also, you know what I mean? Addicts and those who wish to help them. This information is for all